Hi, ladies and gentlemen. My name is Simon Timpley from the International Food Safety and Quality Network. Welcome to edition 59 of the Food Safety Fridays webinar program. We're back live. We had a few technical difficulties. We had to do a couple of postponements, play a couple of replays, but we're back live today with Margaret Kolk, Director of Training, SCS Global Services. Margaret's presented once before and she's back with effect, and this week's webinar is training for FSMA Food Safety Controls. Compliance, is it working? Is training working? Just to say, this webinar today is being recorded, so if we do have any technical mishaps or you have to get called away, don't worry, we'll be sending an email afterwards with a package of the recording, the slides and the certificate, so don't worry about that. I know you'll all ask anyway in the sidebar, but it is being recorded today. Just to direct you, if you're new, in the sidebar you should see chat, room, polls, offers. In the chat with each other, say hello, tell us where you're from, and throughout you can pose your questions. Sometimes other attendees answer, and if not, we'll pick them up at the end and pick through the questions. So type away. We'll be having some polls. So feel free to join in the polls throughout, and we'll have some fun. Just to say, today's webinar, obviously, the webinar program is sponsored by FSSC 22000, Metal of Toledo, Trace Analytics and Safe Food 360. They've sponsored all of these webinars and helped to bring you this free education free of charge each week. And the good news is next year we've got another program we're putting together at the moment with almost 30 webinars. So we're going strong. We're not running out of steam yet. On that point, I'll just introduce you to Margaret. Hi, Margaret. How are you doing?
Great. Simon, how are you?
I'm great. Well, I'm in Manchester and you're in California. Is that correct?
I am. I am in foggy San Francisco Bay Area.
Oh, it's foggy today. It was foggy
Very
here.
foggy,
Yeah.
yes.
Well, it was foggy here yesterday, so maybe, yeah. Manchester's like California for once. Okay, while you get your slides ready, Margaret, I'll just talk about next week's webinar for a moment. Okay, so
sounds good.
See you in a minute. Right, ladies and gents, hopefully you will see in the sidebar a picture of, sorry, let me just make sure I've got it. It's Earl Arnold from AIB International. And next week, Earl is on and he's going to be doing a webinar on conducting a vulnerability assessment for intentional contamination. Yeah, where are we vulnerable, and how can we mitigate those risks? So we'll be with Earl. So either click the register now button in the sidebar, it'll open a new window, or you can follow up with the emails that we send. Okay, right, enough from me. We're going to head over to Margaret now, and then I'll be back for a few polls and for the Q&A at the end. Okay, over to you, Margaret.
Okay. Well, thank you everyone for attending the webinar. I have to give you a little bit of a preface. When I decided to do a webinar on this topic, it was actually probably last January of 2016. I am a preventive controls lead trainer, qualified through the Food Safety Preventive Controls Alliance. So I have been teaching the Preventive Controls for Human Food course for almost a year now. My plan was to actually do some polling of attendees for all of the trainings offered for FSMA. Turns out the trainings weren't coming as quickly as I had planned through FSPCA, so I have a somewhat limited polling to share with you, but what I'm going to go through with you now is I'm going to be talking about what the training requirements are. So I'm going to give the training profiles for each of the 7 FSMA rules, actually for 6 of the 7 FSMA rules. The 7th one, the accredited certification auditor, does not require training for a supplier. So this is me. I'm the Director of Agriculture, Food Safety and Training for SCS Global Services. We are a certification body, and we're located in the San Francisco Bay Area. We are a global company, though. Our services we offer, in addition to a certification body for food safety, we also offer fair trade, sustainably grown, non-GMO, and everything you see there on the screen. Enough about us. Let's talk about FSMA. I'm sure most of you on the webinar are familiar with the Food Safety Modernization Act, which was signed into law by President Barack Obama on January 4th, 2011. It is the most sweeping review or change in the food safety laws in the United States since 1938, when the Food, Drug, and Cosmetic Act was signed into law. This law emphasizes prevention rather than reaction, so let's be preventive rather than reactive to our food safety issues. Expands existing good manufacturing practices. We went from a different Code of Federal Regulation number 21 CFR 110 to 21 CFR 117. So basically, this is sort of in a nutshell what the intention of the Food Safety Modernization Act: enhance partnerships with other partners, both domestically and globally. Import safety is very important. So those importing food into the United States will be required to be responsible for the safety of the food. As I mentioned already, prevention, and then inspections. We will be partnering with accredited certification bodies for inspections. We will also be using local and state health agencies to perform the inspections that will be required under the Food Safety Modernization Act. So let's do a quick review of the 7 rules. The 2 rules that are now in effect for some companies, those companies that are not exempt. The Preventive Controls rule for human food, compliance date for larger companies was September 17th, 2017. FDA has already started inspecting those larger companies. And the Preventive Controls for animal food, so those that are manufacturing feed or food for animals. The Produce Safety Rule, we still have a bit of time for the Produce Safety Rule, so a little less than 2 years. The Produce Safety Rule goes into effect in 2018. The Foreign Supplier Verification Act program goes into effect in 2017. Sanitary transport again. Actually, that's coming up upon us within the next few months, March 31st of 2017 for sanitary transport. Food defense or intentional adulteration, as we're calling it, July of 2017, and then third-party certification, which applies to accreditation bodies like SCS, will go in, if you choose to become a third-party auditor for FDA, goes into effect in November of 2017. So who is affected by FSMA? All of those listed there on this slide are affected by FSMA. So basically, FSMA has a global reach. I have a poll for you now. I'm just curious, those on the webinar, are you affected by any of the 7 rules? And if so, which one affects your business?
Okay, yeah, I've loaded that in the sidebar. Which of the following 7 FSMA rules affects your business? Preventive controls for human food, preventive controls for animal food, produce safety, foreign supplier verification program, intentional adulteration, mitigation, sanitary transport, and for some reason the poll system won't let me put accredited third-party certification. So if that applies to you, just type that in the sidebar, please, and then we'll have a look at the results. And we can see quite clearly already, Margaret, over 80% preventive controls for human food, 0 animal food,
Okay.
7% produce safety, 8% foreign supplier verification. So yeah, the vast majority preventive controls for human food, and then around about 8% for produce safety and foreign supplier verification program. That's okay.
How about intentional adulteration mitigation or food defense?
1%.
Are we getting any response on that?
Just 1%.
Okay, good. Then I'm glad I'm taking the time to go over the requirements and those who are covered by this regulation.
Okay.
Okay. All right, great.
Yeah.
Thank you. Okay, let's talk about the FDA's training strategy for just a second. As I said earlier, I am the FDA has and FSPCA has very strict rules on what they're allowing the preventive controls for human food and animal food trainers to call themselves. So I am a lead trainer, which means that I've gone through a train the training. And I qualify through experience and education, which basically means I am a food scientist and I have lots and lots of years of experience in food safety. So to tell you a little bit about their training strategy, So the very first FDA Food Safety Alliance was the Seafood HACCP Alliance, which was originated through the Association of Food and Drug Officials in 1996. I'm going to date myself and tell you that I am a Seafood HACCP trainer, and that I took one of the first Seafood HACCP Alliance trainers, and I think I took mine in 1998. So the Alliance, the Seafood HACCP Alliance, served as a model for several alliances that now develop and operate. So Juice HACCP Alliance, and then, of course, jump forward to 2011, the Food Safety Preventive Controls Alliance, as well as the Produce Safety Alliance and the Sprout Safety Alliance. So since its inception, just to give you an idea of the reach of the alliances, the Seafood HACCP Alliance has conducted over 1,607 training programs, which have trained over 29,000 individuals. Okay, so what we're going to do for the remainder of the webinar until we get to the end, and I can show you what my metrics are on the feedback on the Produce Safety Alliance training, is we're going to go over the requirements for each of the rules for training. So the first one we'll start with is the most popular, the preventive controls for human food. So who's covered under the preventive controls for human food rule? I'm not going to read the slide. I'll let you do that. However, all facilities that are required to register with FDA under the Bioterrorism Act of 2002 most likely are covered. And again, there are exemptions, and I'm going to talk just a few minutes about those exemptions. Most facilities know whether they're exempt or they're not. Again, this applies both to domestic and foreign food facilities. So the exemptions are those facilities that are covered under the Juice and Seafood HACCP programs. FDA considered that they already had their their food safety programs in place. They were working well. Let's not fix something that's not broken. So activities within the definition of a farm. So the farm definition, those of you who may have been following the preventive controls rule and FSMA in general, understand that the definition of farm really changed from 2011 when the FSMA was first introduced to the final rules of 2015-16. Low acid canned foods, and this is only for micro only, meaning that it's applied for micro only. If you've identified a chemical or a physical hazard, then you must comply with the preventive controls rule. Alcoholic beverage processing is not covered. Dietary supplements, so vitamins and that sort of thing, are not covered. They're also not regulated at this point. So storing, they're regulated by FDA, but they're not covered under this rule. So storing raw agricultural products other than fruits or vegetables, so things like grains, corn, wheat, that sort of thing, is not covered. And storing unexposed packaged food at ambient temperature. So if the food you process or manufacture requires temperature control for an identified hazard, you are covered under the preventive controls rule. Okay, so under the preventive controls rule, a qualified or preventive controls qualified individual, or a PCQI, this is a new term that's been introduced by FDA, the Preventive Controls Qualified Individual, and it's defined as someone who has successfully completed certain training in the development and application of risk-based preventive controls, or is otherwise qualified through job experience to develop and apply a food safety system and plan. So the written food safety plan that food facilities are required to create must be prepared by a preventive controls qualified individual, or the preparation must be overseen by a preventive controls qualified individual. So the qualified individual is also charged with overseeing the validation that the preventive controls are capable of controlling the identified hazards, as well as overseeing the review of records, as well as being responsible for the reanalysis of the food safety program or food safety plan every 3 years. Another poll, Simon?
Okay. Wasn't prepared for that. Are you, or just hang on a second. Sorry. Right, I have set that in the sidebar. Are you or will you be your firm's PCQI? Yes or no?
That's your Preventive Controls Qualified Individual.
Okay, and it's the old 80-20. Yes, well, 78-20, 78-23, 70, yeah, it's roughly 80-20, yes.
Okay, okay, great, thank you. All right, so let's talk about training, which is the focus of our webinar. So some of the previously non-binding provisions in the good manufacturing practices, such as education and training, are now binding. So as per 21 CFR 117.4, management is required to ensure that all employees who manufacture, process, pack, or hold food are qualified to perform their assigned duties. So basically that means employees must have the necessary combination of education, training, and/or experience. Now, for those of you who have taken maybe a preventive controls qualified, and I'm going to be asking that question in one of my polls, a PCQI training course delivered by someone like myself, a lead trainer, you probably already understand this is not a required course. FDA is not mandating that you take this course. However, if you're going to take a training to qualify as a PCQI, you must take the course that they consider to be the curriculum that is approved by FDA. So the Preventive Controls Qualified Individual Training that is developed by the Food Safety Preventive Controls Alliance is that recognized training. However, you may just have the experience and necessary to prepare a food safety plan. So that, again, the training is not required. However, as a lead trainer and as someone who has been involved in HACCP for the last 25 years, it certainly is an eye-opener, and I think it's something that's really quite important for those of you who will be PCQIs to have taken this course. And I'm not selling it as a lead trainer. It's just something that I know when I took the trainer myself, it was certainly well worth it. I learned quite a bit, and I'm always happy to share what I learned in the trainer because it's really important information. So again, the equivalent in curriculum recognized by FDA or have that necessary job training or experience. Okay, so this is my next polling question. Have you taken this recognized course?
Okay. Have you completed the FDA recognized course? Poll is loaded. So please vote yes or no again.
Now these are really easy polling questions.
Yeah, much easier.
Doesn't require a lot of
ones I like. They just need somebody to switch them on. I've not got much of a job to do, but you know. Well, yes, 41%, no, 59%.
Ah, okay.
So the majority have not completed the FDA recognized course Preventive Controls for Human Food.
Okay. All right. Well, so let me tell you a little bit about how the course was developed, who developed it, where it came from. So the Food Safety Preventive Controls Alliance originated in 2011. It was coordinated through the Illinois Institute of Technology's Institute of Food Safety and Health, or as we affectionately know it, IFISH. So the Alliance has developed the standardized curriculum, the standardized training and education program, along with the technical information network to assist companies in compliance with the preventive controls rule for human and animal food, as well as the foreign supplier verification program. So what they've basically done is develop the standardized training courses. They're going to be offering distance education modules, which are not available yet. They offer other resources to help companies develop the food safety plans. If you have not been to their website, Google FSPCA or Food Safety Preventive Controls Alliance. There's a wealth of information on that website. So they're basically there to help you develop your food safety program, which includes, of course, conducting your hazard analysis, implementing your preventive controls, learning how to monitor, verify, take and make corrective actions, and then document those efforts. So the Alliance is supported by a grant from the FDA. It was awarded to the Illinois Institute of Technology's iFish. And basically to outline what they've done or they will be doing. So they're in the process of designing state-of-the-art distance learning portals, which will be housed at the iFish Moffitt campus in Bedford Park, Illinois. They're creating complementary training materials that pertain to specific commodity or industry sectors dealing with human and animal food. For those of you who have already been through the training, you know that they use one specific model to deliver the training, so it's included in the training materials. And then they use 5 different models. They've developed 5 different approved models to work through the training exercises when you take the 2.5-day training. They're providing input to the USDA regarding guidance for the food hazard analysis and preventive controls. They've already established a technical assistance network, or TAN, to provide technical assistance to the food industry. And I have to tell you, this is specifically directed toward those small to medium-sized businesses. So I know oftentimes when I teach a course, and I'll give you some of the feedback, so I'll give you a heads up on some of the feedback that we get from participants of the course. There is a HACCP component to the preventive controls rule. It's the process preventive controls. And as I teach the course, people are wondering, well, why don't you teach a course for people who are already familiar with HACCP? Well, FSPCA developed this course especially for small to medium-sized businesses that may not have HACCP plans in place. So that's why there is a section of the course that is specifically devoted to process preventive controls, which bottom line is it's basically HACCP. So what the other things that FSPCA are doing, they're assessing knowledge gaps, and they're doing some research to further enhance preventive controls measures. And this is really pretty special. They're also identifying and prioritizing the need for compiling minimum maximum values for parameters, or as we know, as we've called them for the past 25 years, critical limits for widely used process controls. So they're going to be basically, if any of you are familiar with the food safety, the Seafood HACCP Alliance Hazards Guide for Seafood, which is a wonderful compendium of all of the hazards associated with different species of seafood, different types of shellfish and fish. FSPCA is working on developing that same sort of a hazards guide with identified parameters / critical limits for specific food commodities. Okay, so let me tell you a little bit about the members and who are these people? Who is FSPCA? Well, I actually was one of the original members who were involved in developing the training guidelines back in 2011, but other duties took over and I couldn't continue my membership. However, but it is a broad-based group consisting of key industry, so people from the industry, academia, and government stakeholders. The mission of the FSPCA is to support safe food production in the U.S. By developing core curriculum, corresponding technical educational materials for food safety risk reduction, preventive controls that comply with the relevant federal regulations. So basically, preventive controls for human food, preventive controls for animal food, and they also are going to be working on the foreign supplier verification training. So they've already developed materials, and they've already gone through, I believe, 2 revisions for a variety of delivery modes, including classroom-based, face-to-face. Basically, that's what we do. The 2.5-day training is face-to-face. Our company actually does a 4-hour webinar, and so we limit the face-to-face training for just 2 days, so people don't have to be away from their businesses or their plants for 3 days. So we do one webinar for 4 hours. Hands-on and distance learning. Again, the distance learning has not yet been developed. It's under development. So they want a sort of a blended learning approach to helping firms implement the preventive controls. So the scope of the FSPCA is basically to develop hazard analysis, preventive controls training programs for FDA-regulated foods, including food for the consumption of human consumption, animals, and pet food. Okay, so this is the method for, again, those of you who have been through the training, you will know, you will recognize this particular slide. So the first part of the training basically identifies, gives you the background and the guidance information on food safety. So what that means is we're talking about, we're identifying the hazards. So we're identifying biological hazards, chemical hazards, physical hazards, and in those chemical hazards are included radiological hazards. So they provide specific, the training provides specific information for the hazards, discusses the underlying principles used for preventive controls, also very briefly discusses good manufacturing practices / prerequisite programs. And then the rest of the remainder of the course basically goes into how to develop a food safety plan. And that's probably the bulk of the 20 hours of the course is developing the food safety plan. Hands-on exercises, using different models. I know my classes that I've taught, we've had capacity, and the most, the maximum number of recommended attendees is about 24 to 30 people. 30 people is really pushing it. So in my classes, we limit it to 24 to 26, and we break the group up into about 5 different groups, and each of the groups works on a different one of the models that is provided by FSPCA. The trainers are permitted to develop their own models as well. However, they must be submitted to PCA for approval. So any of the models, if you attend a course in any of the models that are not, there should not be any models developed that are not and delivered that are not recognized by FSPCA. And the final section is going over the preventive controls regulation for human food. That is done by a video. That's section 16, done by a video that's delivered by Jenny Scott, who works for FDA, and I certainly get a lot of interesting feedback on that video. But we as trainers either have to show the video or we have to go over the regulation ourselves. And since Ginny was one of the people that actually was involved in the development of the regulation, in my classes I let Jenny talk about it. Okay, so what is expected? What's the successful outcome when you complete the course? This is one way for you to meet the requirements of a preventive controlled qualified individual. So again, participation in the course is actually vital for completing the course and actually understanding the intention of the course and becoming a preventive controls qualified individual. All right, so since we have very few people on the, I don't think we have any, do we, Simon, that must be in compliance with the animal food rule?
I think actually there were one or two, and a few people actually said they wanted to pick more than one option, which it restricted them to one option on the poll.
Oh,
so, yeah.
Okay.
It's nice. Okay.
Okay. All right. So who's covered? Facilities that manufacture, process, pack, or hold food that is intended for animals. And then here's my next poll. Does this rule apply to you?
Okay. Yep. That poll is in the sidebar. Have you completed the FDA recognized course, Preventive Controls for Animal Food? So we're expecting a small percentage, although 10%. So maybe there was a bit shy in the first poll, or joined late, or maybe produced more than one thing applies to them. But yeah, 11% yes, I have completed the animal food, and 90% no.
Okay, great, thank you. Okay, so this, I am not a trainer for the animal foods rule. My background is in agriculture and food processing for humans. So we do have on our team at SCS, we do have a couple of trainers who are well-versed in animal feed and animal food, so they are teaching the course. But basically the same requirements. So this regulation requires that certain activities must be completed by, again, a preventive controls qualified individual who has successfully completed training in the development and application of risk-based preventive controls or otherwise qualified through job experience. So again, not a requirement that you take the training. However, it is recommended because you will become very familiar with the rule and the requirements. And this particular course is, again, the FSPCA course is the standardized curriculum recognized by FDA. So when you successfully complete this course, you will meet this is one way for you to meet the requirements of a preventive control qualified individual. Okay, so produce safety. All right, so let me talk a little bit about produce safety and the requirements of the regulation, and then we'll talk about the required training. So this is sort of, for those of you in the U.S., and I'm assuming many of you are located in the U.S., the produce safety rule has been a long time coming. So the rule establishes basically science-based minimum standards for the safe growing, harvesting, packing, holding of produce which is produced on farms. So the rule includes new standards for growing, harvesting, packing, and holding food. So the rule applies not only to domestic produce, but also to imported foods. Now, but all of the rules, the preventive controls for human food, the preventive controls for animal food, and the produce safety rule also apply to foods that are imported. However, it's the importer that's required to ensure that the food is safe. So the produce safety rule covers most fruits and vegetables while they're in their raw or natural unprocessed state. However, it does not apply to raw agricultural commodities that are rarely consumed raw. So things like asparagus, winter squash, potatoes, eggplant, they are not covered under the rule because they are typically not consumed raw. So those foods that are produced for personal or on-farm consumption, actually I should go to my next slide because that's what this slide says. Those destined for commercial processing such as canning, because they will be covered in some aspects under the preventive controls rule, and other foods because the processing will adequately reduce the microorganisms of public health concern. And then those farms with produce sales of less than or equal to $25,000 per year. Okay, so what do the standards focus on? They focus on the conditions and practices identified as potential contributing factors. This training is not yet, I believe it's ready for prime time. I have the training materials. However, we still have some of our trainers going through the Train the Trainer. I went through the original Train the Trainer back in 2015. Before the rule was finalized, and they've made some modifications to the training for this particular rule. The training will be available in January and February. We're going to be offering it at SCS in January and February. So these are some of the, as you see, worker training is one of the caveats or one of the requirements under the produce safety rule. So basically, it covers worker training, it covers health and hygiene. So as we know, fresh fruits and vegetables that do not receive a kill step, such as processing or cooking before it consumed, pathogens can contaminate the produce. We're all familiar with foodborne illness outbreaks associated with a variety of produce items like lettuce, peppers, tomatoes, cantaloupe. Those of you in the U.S. are very familiar with some of these really very tragic foodborne illness outbreaks associated with unprocessed produce. And as we know, workers on the farm are critical to any part of food safety. They're responsible for using food safety practices while they're working. And food safety practices are learned. They're not something that you're born with. So training is key to successful implementation of your food safety program. And it also can prevent a challenge on the farm when you're implementing the food safety plan. This is new to a lot of farms. Every day, our office gets a phone call from one of our farmers who is one of our clients for maybe we're doing a GMP audit of their pack house. Now they have to implement training for their employees. The challenges that can be presented, there might be language barriers. There might be workers who actually don't read in any language, so you have to make sure that any kind of training that's done, the materials, if they're printed, they need to be printed in the language in which the person in the native language in which the person reads. Maybe you have to use pictures for those workers who don't read, showing the workers what to do. But there needs to be effective training in place. And as we all know, most people are visual learners, so there should be some sort of pictorial involved in your training anyway. And then there are those, most farmers, I know in the state of California, I'm very involved in the grower world here, most farmers bring additional labor on at the height of a harvest. So those people also have to be trained, and it's really busy. There's a lot going on the farm, and training sometimes may not be a priority. Oftentimes it's not a priority. And oftentimes it's sort of done on the fly. This is how you wash your hands. This is what you need. These are the tools that you need, and they need to be kept clean. However, this produce safety rule requires that all personnel who contact covered produce, like strawberries that are being harvested in this picture, they need to be trained. And so it requires that they go through training that includes principles of food hygiene and food safety. So how to wash your hands, how to come to work every day wearing clean clothes, how not to sneeze on the produce that you're harvesting. That's personal hygiene. And then the food safety practices. We can't emphasize the importance of health and hygiene for all personnel who are working on the farm, including visitors. So the recognition of symptoms of a health condition that could result in contamination of the food or food contact surfaces. So all workers that handle or contact covered produce and those who supervise covered activities must be trained. Now, this is a federal regulation. So, however, really anybody that works on the farm should understand the company's food safety practices. So in addition to the training requirements, supervisors that handle covered produce during harvest, they require at least one. It requires that at least one supervisor from the farm complete food safety training, again, equivalent to the standardized curriculum recognized by FDA. So the produce safety training that is produced by the Produce Safety Alliance is that standardized training that is required for a supervisor, not all of the employees on the farm, but a supervisor. And it's that supervisor's responsibility to ensure that all of the people harvesting the produce and working with the produce on the farm have been trained in personal hygiene and food safety. Again, that's regulation. So where do these training materials for that supervisor come from? They come from the Produce Safety Alliance, yet another alliance, which is in collaboration with USDA, FDA, and Cornell University. So, as I said earlier, these training materials have gone through several reiterations. They have been finalized, and the trainers are going through the Train the Trainer programs right now as we speak. We just had two of our trainers go through the Train the Trainer in Salinas, California, which is in the heart of the produce industry, and in Southern California, in the Irvine area, go through the Train the Trainer. So they're ready to start training. It's just now a matter of having the Produce Safety Alliance give us the green light to go ahead and start the training. A little bit about the curriculum and the objectives of the training. The objectives of the training, there are 4 objectives, and I won't read those to you on the screen, but I'll explain them to you. So we want to provide educational outreach to assist fresh produce growers and packers, including grower cooperatives, to increase their understanding of the critical role that they play in the public health and safety of consumers. So basically these trainings were devised and developed specifically for those growers and pack houses for the on-farm environment. So farmers are expected, or the supervisors again, are expected to go through these trainings. So they've developed a standardized training for education about produce safety, as well as the benefits of training and understanding the benefits of environmental co-management on the farm. So who should attend? Again, this is for a supervisor, so a higher level person who has a better understanding of the operation of the farm. So as I said, the trainers are going on right now. The grower training will take place beginning in winter of 2017. So a little bit more about the Produce Safety Alliance and the Produce Safety Training. The standardized curriculum was created through a 4-year nationwide development process. So this started back in 2011, right after the Food Safety Modernization Act became law. So this was a compilation of, they had working groups comprised of 178 unique members from academia, agriculture, industry, regulatory agencies. They identified key areas and learning objectives that were to be addressed in the training programs. They actually also, they went out to the farmers. They did a farmer focus group nationwide in the U.S., collecting feedback from 89 produce growers. So as you can see, there was a lot of research done in preparing to develop these training materials. So they also engaged with FDA, the Division of Produce Safety, to align the curriculum with the content of the Food Safety Modernization Act Produce Safety Rule. So the 7-module Produce Safety Grower Training course was designed to be delivered as a 1-day course, although I have to tell you, when I went through the training, it was a 2-day training, and there is a lot of information. So as a company, we're still trying to figure out how we're actually going to deliver the training, because it's a lot of information for 1 day. Best way I would think would be through sort of chunks of training done over a period of time. But the curriculum covers the produce safety rule, covers good agricultural practices. Again, at least one person from a supervisor must go through the produce safety training. And again, this produce safety training satisfies the FSMA requirement for training for a supervisor on the farm. Now, in addition to the produce safety training, or the Produce Safety Alliance, there is the Sprout Safety Alliance. FDA considered this to be an important enough food sector category of the produce industry to also develop curriculum within the Produce Safety Alliance. The Sprout Safety Alliance was developed. Their curriculum has been finalized. And they will address, so the curriculum for the Sprout Safety Alliance actually addresses part of the Produce Safety Alliance training, but is very specific to the sprout production community. So the Sprouter, they're calling it the Sprouter training course, is again, unless sprouts are, the grower is specifically exempt or excluded from the sprout grower training or the sprout growing operation, you are subject to the produce safety rule, including the sprout-specific requirements. So the 2-day Sprouter training course was developed by the Sprout Safety Alliance. Again, it meets the standardized curriculum recognized by FDA. As you can see here on the screen, the Train the Trainer started taking place in September of 2016. They went through a pilot in November. No, the pilot is going to be delivered in December of 2016. So in mid-December of 2016, they're going to be delivering a pilot. And the grower training courses are not yet being offered. That slide is a little bit misleading. They will be offered in January of 2017. Okay, let's talk a little bit about the Foreign Supplier Verification Program. I'm not sure how we're doing on time, Simon.
It's 1:45, so.
Oh, okay. I want to get all of this in. So the Foreign Supplier Verification Program requires that importers perform certain risk-based activities to verify that food imported into the U.S. has been produced in a manner that meets applicable U.S. food safety standards. So it is in alignment with the Preventive Controls supply chain provisions. So this is what it does, the Foreign Supplier Verification Program. Again, in the matter of timing, I won't go through specifically, but who must comply. So basically, it's the U.S. owner or the consignee of the food at the time of U.S. entry. Okay, so the Foreign Supplier Verification Program really is on the requirements are on the shoulders of the importer. So the countries with comparable or equivalent safety systems, they may not have to comply with these requirements, but there are only 2 countries that are equivalent at this point, or designated equivalent by USDA, by FDA, and that is New Zealand and Canada. So the countries, the equivalency has been determined by FDA. New Zealand and Canada are 2 of those countries. Exemptions, I'm not going to read that to you. So these are the exemptions. Also, food that is transshipped, so food that might be coming from Canada and is headed for Mexico and is not stopping in the U.S. It might be going through on a freight train. That's not covered. Food that is imported for processing into the U.S. and then immediately exported, not sold in the U.S., is also not covered. U.S. food that is returned is not covered, and meat, poultry is covered under USDA, so that's not covered under FDA. So a qualified individual is the person who must oversee the food safety, the Foreign Supplier Verification Program, the training required for it, which is really what I want to focus on. So the curriculum is currently in the development stage. I believe I can give you some dates on that. So the walkthrough for the Foreign Supplier Verification Program curriculum happened in November. Scheduled dates for the exercises, so exercise development, they're walking through them again in mid-December. So the pilot is proposed for late January, and how FSPCA sees the delivery of this is as an add-on to the Preventive Controls course. And then, of course, as I mentioned earlier, they're going to be offering web-based courses, so this may be a module as part of their web-based course. Sanitary transport rule. Sanitary transport rule covers shippers, receivers, loaders, and carriers. And because I want to focus mainly on training, these are the definitions of a shipper, a loader, a carrier, and a receiver. So who's covered? Again, it's shippers who ship food into the U.S. directly by motor or rail vehicle or by air. Who's not covered? Shippers, and then again, I'm not going to read that to you because you can read that yourself. So food on farm transport is not covered. Transshipments, again, through the U.S., like the Foreign Supplier Verification Program, not covered. And food not consumed in the United States is also not covered. Also, food that is fully enclosed by a container, except for live animal foods are not included except for mollusk and shellfish. Compressed gases and food contact substances are not covered. And then human food byproducts used for animal food are also not covered under the sanitary transport rule. So these are some examples of foods that are subject to the final rule. Foods transported in bulk. I have a photograph there of liquid eggs, as you can see on the logo on the back of the truck. Packaged foods not fully enclosed in a container, so fresh produce would be covered. And of course, foods that require temperature control for safety. So what are the training requirements? I'm going to pull out one of the four. So the carrier personnel must receive adequate and documented, that's important, documented training on sanitary transportation practices and awareness of food safety issues that may occur during transport. So FDA sees this as a very brief 1 to 2 hour webinar. There have been no training materials developed as of today that I'm aware of, and I've tried to keep myself up to date with all of this. But they don't see it as something that the transporter, the carrier, is going to have to take time out to attend a live class. They will be delivering this sort of training as a webinar, and I would guess that it probably would be through the FDA portal. And when I get to the food defense section, I'll talk about the FDA portal for training. Training records must be kept for the carrier as well. Okay, so let's talk about food defense, mitigation strategies to protect against intentional adulteration. The purpose of the rule, it's basically to defend against any intentional terrorist acts or any intentional adulteration of food products. So it establishes the requirements to prevent or minimize acts intended to cause wide-scale public health harm. It uses a HACCP-type approach with important differences from the Preventive Controls rule for human food. It's risk-based and flexible. Who's covered? And I'll let you read on the slide who's covered. Farms or retail establishments are not covered. Domestic and imported food facilities and some exemptions. Very small businesses, the rule does not apply to very small businesses. FDA identifies very small businesses for each of the seven, or actually each of the six of the seven rules. And they vary, so I'm not going to get into the definition of a very small business. If you are a very small business, you most likely know what your definition is. Okay, what's required? You must have a food defense plan in place. You must have a vulnerability assessment, so we call it TACIP, Threat Analysis Critical Control Point, mitigation strategies, food defense monitoring, corrective action procedures. So again, this must be included in your food defense plan or your intentional adulteration mitigation. So a poll, does your firm have a food defense program in place currently?
Yeah, I've loaded that poll in the sidebar. Does your firm have a food defense program in place? Yes or no, simply. So please vote quickly. And yes, 80%.
Oh, great.
80% yes, 20% no.
Okay, very good. So if you don't have a food defense program in place, FDA has provided you with a wealth of training information. Okay, so you have to have training. So you have to have food defense awareness. You have to have those mitigation strategies in place. So just a little bit about the training. So the Food Safety Preventive Controls Alliance, again, has been tasked with developing additional training to what's already available through FDA on their website. So they had their kickoff meeting in September of 2016. Their plan is to develop a combination of online and face-to-face standardized trainings to support the intentional adulteration final rule. The development process is underway and is being done in concert with guidance from the FDA. They're also developing guidance as they develop the training. So each component of the training will be drafted by FDA subject matter experts, reviewed by the Intentional Adulteration Subcommittee. You can imagine all the people that are involved in developing all of these trainings. And pilot sessions, as appropriate, will be held to make sure they've covered everything. And who knows, maybe your company might be involved in some of the pilots. So I've listed the Access Data FDA training website. There is a lot of training information regarding food defense. You can just Google FDA food defense. And again, there's food defense awareness for the food safety professional. There's food defense awareness for the frontline employees. There's something called Alert, and I teach that whenever I teach my prerequisite programs. It's a very quick, easy overview for your employees. If you haven't done it already, I highly recommend that you do that. Okay, so let's talk for just a few minutes for the remainder of the, I think we've got 7 minutes left of the presentation. I did some stats. I have been getting feedback from from both from FSPCA as well as from my own training classes. So I've got some metrics, evaluations, and feedback on the preventive controls for human food training. I have no other statistics at this point because the only two trainings that are really currently being offered are human food and animal food preventive controls training. So this is from FSPCA. So far, there have been 28,236 preventive controls certificates issued to participants. There are 1,291 of us lead instructors out there presenting this training. There have been 2,129 preventive control courses registered on the FSPCA website, and I won't go into all of the details, but in order to be able to present the class and in order for you to get the official Food Safety Preventive Controls Alliance certificate, you must take the course through a trainer that has registered the course with FSPCA. So basically what I do is I have our admin register a course if I'm going to be training it. I have to submit the names of the people that are going to be taking the training. I have to buy the materials through the FSPCA. So there's a lot of preparation obviously involved in presenting any type of training, but this is all done through the Food Safety Preventive Controls Alliance. Once the training has been completed, the trainer submits the names of those who completed all 20 hours of the training to the FSPCA. The FSPCA issues an official certificate. So they send the participant a link to their website, and you can download your certificate off of that website. So there are 310 upcoming courses. If you have not taken the course yet, recommend that you go to the FSPCA website and if you're interested, and find out when the next course is going to be delivered in your area. So what I've done at this point is we've done, and FSPCA has done the same thing, so I've combined the two. We've done a level 1 evaluation survey. So basically this is just the feedback. So the rating from 1 to poor, one being poor, 5 being excellent. So what were the course expectations, evaluation of the expectations, evaluation of the course materials, and evaluation of the instructor's skills. So we asked specific questions. The questions we asked were, did the course meet my expectations? Was it useful and relevant to my job? I feel confident using the information in my workplace. The materials, were the materials relevant and easy to use? Was the information current and informative? And then basically we asked about the knowledge and capability of the instructor. Was the instructor prepared? Did the instructor share industry experience? And what was the overall performance? And then we asked the questions of how could the course be improved and what was the best part of the course? So here's some of our results. Basically, again, on a scale of 1 to 5, this is the FSPCA evaluation questions and responses. So I included in this webinar all 14 of their questions. So you can just take a quick look as to how people responded. Those of you who have taken the course actually probably responded to these questions. So you're included in this polling. And the next one is the instructor's ability to interact with the class. And again, high 4s. So everyone seems to be fairly satisfied with the delivery, the course materials, and the instructors. My evaluation compared with SCS evaluation, compared with the FSPCA evaluation. Again, high 4s. We had several 5s when we did our analysis. So really, there seems to be a very good response rate and a very good acceptance of the course. These are some of, and this is in graph form. I like to show a little graph form with some color in here. So this is our ratings compared to FSPCA's ratings, and you can see that they vary. Okay, so these are some of the learner comments. And those of you who have taken the course, I'd be very curious to see whether you agree with these or not. So do the hazard analysis last. The hazard analysis is done at the very beginning of the course. People want clear examples of models. Again, FSPCA is developing those, and lead trainers can develop their own and have them approved by FSPCA. There's a lot of material for 2.5 days, 20 hours. There is a lot of material. Again, I mentioned earlier, people who are already HACCP trained, why can't we just summarize all of this and give it to you in a nutshell? More visual slides. The FSPCA slides had no pictures on them. Less slides. There are, I forget, something like 400 slides. A lot of slides. And then the video. The video is basically an FDA video. If you've seen an FDA video, you know what I'm talking about. So it's a little boring. Okay, so what's the next level? My next step is to use SurveyMonkey and go back to those who have taken the training a minimum of 3 months later and find out how effective the training was for them. Were they able to apply the training in the workplace? And then my intention is to be able to share the results in the future. And that's it. I'm finished. I'm sorry this seems so rushed. I thought I would be able to fit everything in 45 minutes.
Wow, excellent. 1 minute to go. That's perfect. What you call perfect timing. Somebody asked in the sidebar what your contact details were, and they're on the back slide there. So the slides will be issued to all attendees, along with the recording, etc. So obviously all that content that Margaret's been through, you will get a copy of, and you can refer to that, watch the video back, and obviously get Margaret's contact details. You can stop sharing your slides now, Margaret.
Okay, I just want to say that please feel free to contact me. I know this was very rushed. I am pretty well versed in FSMA. I've been living it for the past 4 years, so please feel free to contact me if you need to.
Yeah. What we'll do, Margaret, if you just stop sharing your slides.
Okay.
We don't really want to run too far over because obviously people have got busy schedules and got commitments and things, but there's loads of questions put in the sidebar, but unfortunately they've scrolled way down. It's probably to New Zealand or somewhere now. So what I might do is go through the chat and pick out the questions and send them by email to you, and perhaps then we can do it that way rather than try and do it now, because we're over time anyway. So
sure, that'd be fine.
I'd just like to say, Margaret, then, thanks for sharing that information with us. Excellent information and lots of good advice and lots of questions answered, definitely. So thank you very much from the IFSQN, from myself and all the attendees.
Thank you.
Yeah.
Have a wonderful holiday, everyone.
Yeah, and hoping that you'll come back next year, maybe.
I sure will. Yes, I will.
Okay, I'll be in touch about that then, Margaret. I've got you on tape now.
Okay.
Thanks, Margaret.
Okay. All right. Thanks, Simon.
Okay, ladies and gents. Okay, there was a lot to get through there. We did do it. We kept on time. That's a target met. Your certificate's in the sidebar now, so you can download that to say that you have attended this presentation today. I'll follow up with an email with the slides, the presentation, and the certificate if you can't get it now. And also, I will follow up with next week's webinar, which is about vulnerability assessment. So, nice to be back live for a change. It's all gone without any gremlins today. So, have a nice weekend. It's Friday, happy Friday, and we'll see you all next week, hopefully. Take care. Thanks.